Hi everybody. The video today is about post-concussion syndrome. The question somebody asked on one of my other videos that prompted this topic is, what are my favorite treatments, i.e. the ones that I see work the best in my office to use for post-concussion symptoms? So thanks for the question. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I've treated many patients with post-concussion syndrome, post-concussion symptoms, and it's kind of interesting just from a clinical perspective that there's a lot of overlap with the types of therapies that we use when we're treating other chronic health issues where there's any type of a neuroinflammatory component, and quite frankly, just a tissue healing, kind of body healing element to things. So the types of things that I see as being the most important in my practice, and it varies. There's of course going to be nuances from one case to the next, but general concepts would be supporting the mitochondria, so using comprehensive mitochondrial support, which I've talked about in other videos a number of times before. If you're interested in more details, I do have a Overcoming Chronic Illness course. The first couple of modules of that are free if you sign up for my newsletter, which the link for that is in the comment section below, or if you're watching this on Instagram, go to my bio and then click on the link tree and you can sign up for the newsletter and get access to the first two modules for free. And I cover the comprehensive mitochondrial support and the rationale behind that in that mitochondrial support section there, or mitochondrial dysfunction module from the course. So comprehensively supporting the mitochondria, very important in many cases. The rationale there is that we want to make sure that the brain cells have all the nutrients that they need in order to make the energy they need to do the healing repair work. Even when a brain is not healing, it needs a lot of energy. A non-healing brain uses up about 22% of all of our energy throughout the day. When there's a healing brain, it needs all that energy and then some to actually do the healing work. So energy production, really important. We also want to work with immunomodulators. One of the kind of challenging things with healing from brain injury is that most other body parts, it's injured, and so you don't use it as much. You kind of immobilize it. It's like you sprain your ankle, you're going to take it easy on that ankle. You break your arm, it goes in a cast for a while. With your brain, you can never stop using it. You can do things to try to take as much stress off the brain as possible. Minimizing screen time and, trying to avoid, excessive mental activity and things like that. But your brain is, of course, always working. It can't ever truly rest. And when the brain is injured and it can't truly rest, then it can really exacerbate a lot of inflammation and just kind of perpetuate some of these, or really get in the way of healing up the damage from that brain injury. One of the things that can be helpful is working with immunomodulating substances, things like NAC, quercetin, curcumin, things like that. Chinese skullcap is an herbal formula that can be helpful for that. And so those types of immunomodulators can be helpful if patients have access to it. Intravenous ozone therapy can be really helpful because it's immunomodulating, anti-inflammatory, helps promote tissue healing, helps with mitochondrial function, so it hits on a lot of the targets that I've talked about so far. So that's kind of part of the immunomodulating aspect of things. And then other just straight up anti-inflammatories, which do overlap with immunomodulators as well, but certain anti-inflammatories like, say, frankincense extract, also known as boswellia, can be helpful. Jamaican dogwood is an herb that can be helpful. So the immunomodulators, anti-inflammatories, and energy production boosters can be really helpful. Now, what's unfortunate is that in some cases, some of the more complex cases, we need to take it further from there. If a patient had pre-existing mold toxicity that was just kind of smoldering in their system, that concussion could drive things over the edge, and then suddenly the body's even more depleted. There's a lot more neuroinflammation, and then it's just like, say if there's a forest that was really dry, and then like a spark just, comes out to the scene, and the whole thing was just ready to go up in flames, so to speak. So if there was some pre-existing issues, say with mold mycotoxins, Epstein-Barr virus reactivation, persistent borreliosis, those types of things, elevated toxins or heavy metals or things like that, then sometimes we need to it kind of turns into this day of reckoning of not only do we need to heal up from the injury from the concussion, but also all the other stuff that then suddenly ignited in the system needs to be treated as well. So it can make these cases sometimes really complicated, and I've had a number of cases where they've already been doing a lot of the right things on paper for symptom management and healing, and yet they're just not getting all the way better. They're protocols might be floundering a bit, and so then we, I take the history and it's like, yeah, you had mold exposure previously. We do testing, you're full of mycotoxins, and so we need to treat the heavy metals, that type of stuff. So some of these cases are, unfortunately, can get drawn out a heck of a lot more than just your kind of run of the mill, like, oh, I was healthy, had a concussion, some persisting symptoms. We can usually heal that up, or work with things to help heal that up quite a lot faster. So those are, I think, the thoughts that I'll share for today. I could probably get into it in a bit more, but if there's any further questions on this or any other specific questions, I'm happy to talk about this topic. Really, really important topic. Some of the folks with post-concussion syndrome are some of the most health impact patients that I've worked with, and unfortunately, there's not a plethora of clinicians out there that are very familiar with post-concussion syndrome and the comprehensive management of it. So hopefully this is helpful, and yeah, I will leave it there for now. So any other questions on this topic, feel free to post in the comment section below. If you have found certain things to be helpful for your own recovery or a family member's recovery or something like that, friend's recovery, random person you met on the bus's recovery from post-concussion syndrome, please feel free to post in the comment section below if you're comfortable with that. It's just always nice to hear about what's worked for folks, and I know folks do like to read the comments, and so it kind of helps to share knowledge if you're interested in doing that. And if there's any questions on any other topics, don't hesitate to post in the comment section below, and I will answer as soon as I can.